This is the Art Beauty Podcast where we tell the real truth about the fake shit. Hi, everybody. I'm Amber, and today my fabulous co-host is Miss Jennifer Hanway. She is a holistic nutritionist, friend of the show, and I love having you on all the time. Welcome, 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 babe. How you doing?
I'm good, and I love being here. That spot in your couch behind you on that with that fluffy cushion, that's mine. I'll take it. We'll have a coffee. Love it.
Oh my gosh, I want to have you here. So
Right?
Funny you mentioned that spot on the couch because I woke up this morning really early and then just sat on that couch with my coffee and all of a sudden realized, oh my goodness, I need to start getting ready. However, I, only like to shower and wash my hair as like little as humanly possible. So I was like, I can get a workout in. I think you'll be proud of me. I got my workout in this morning and then I was like, I don't have time to dry my hair. So it's
Great.
back. And I was like, you know what? We're talking about women in their 40s. And I want to make sure that everybody understands that women in our 40s, we can be fabulous. So I threw on this glam jacket to make up for the rest of the hot mess that's going on here.
If that is hot mess, then my goodness. So
Oh,
yeah, and women in our 40s, we need to cut ourselves some slack, right?
we sure do. And I feel like I'm going to embrace this. I feel like I'm having like a Robert Palmer moment. Do you know? Right? I was like, wait a minute. We're just going to go with this. How's your day going? I heard you had a morning too.
Yeah, I had a morning. I've had a morning. I was exactly the same thing. I wake up so early, but then I'm always running late. I'm like, what have I been doing for the last 4 hours? Yeah.
I'm glad you bring that up though. It's like we got to cut ourselves a little slack sometimes. I mean, you were
Right.
just here in New York,
Yep.
you're always on the go. Are you back in Boston now?
I'm back in Boston now. Yeah. So, but yeah, we have to. I will cut you slack. You will cut me slack. I cut my client slack. When do we ever cut ourselves some slack? We don't do it.
We don't. We don't. And we really need to. And I'm so glad to have you on. Again, I feel like I've known you for a long time and being in the beauty business, I mean, for over 2 decades now, I've seen it change. But it's funny, right? Like when I was 20s and writing about, anti-wrinkles, I'll never forget my mom called me one day and she was like, no offense, darling. You don't
You've
have
got
any
no idea.
wrinkles. And like, I've seen that shift though in beauty, especially, in the media where it was like, now we're kind of, women in their 40s are addressing women in their 40s. And we've embraced sort of this older, journalist, if you will. And so I'm glad to have you on because I feel like, I think we all know this, nutrition, beauty, everything in our 40s is different than it was in our 20s.
It's different in our 20s, and it's so interesting because I've been having this conversation with so many people. You, and I saw you the other day, Dr. Russak. Are we becoming more? Is there more of a conversation around this, or is this just where we're at in our lives? And I actually think it's both. When we're in our 20s, we look for things that speak to us then. Now we're in our 40s, we're looking for things that speak to us then. But I do think there is a much bigger conversation about it. And I'm so glad you say that. I go on Instagram and you see these, 20-year-olds talking about their wrinkles and their Botox. I'm like, you have not a wrinkle on your face.
No.
We're always very open. I'm at that point that 3-month point where I'm due for my Botox, 2.5 months, and then my body just eats it. And I think we all need to be, I think there's more of a conversation around these things, but I think there needs to be even more of a conversation. And this is just the tipping point.
By the way, I'm doing an episode later today, which will come up, after this one, but on this new, Botox alternative called Daxify. I know nothing about it except that they are saying that it lasts 6 months. This could
I'd
be.
like to give them the challenge of my forehead lines.
I mean, I want to learn all about it first before, before we go down that rabbit hole. But
Right.
Wouldn't that be nice? Because I'm the same every 3 months.
I mean, I hear it's actually a good thing. It means a little humble brag here, but it means that we have fast metabolisms.
Yeah.
And I'm like, can I choose when I have a fast metabolism?
Oh.
And can my Botox please last more than 2.5 months?
Yeah. I mean, I wish the fast metabolism meant that when I'm not being, or let me actually not say when I'm not being good, when I'm enjoying life, it doesn't show as quickly,
Right.
But anyway, so let's talk about that, because do you
Yeah.
find a lot of your clients are maybe in their 40s, 50s and up?
It's literally the demographic that I work with now.
Okay.
And if the client is not in their 40s, and this is where I love to get them, I've had a number of clients just turning 30, and they're like,
Okay.
you know what? I want to figure out everything now so I can breeze through my 40s, 50s, and 60s. And I'm like, hallelujah, this is amazing. But no, the majority of my clients are mid to late 40s, early 50s. And what worked for them when they were 20 doesn't work for them now.
No, and we've also got, the 40s now, and even as early as the 30s, we have to deal with things like perimenopause, menopause, postmenopause, the hormone changes. So I know personally, we've been talking about your program forever. And I told you, I know when it's right. And I've decided it's right now, because I know I'm not in perimenopause yet, I don't think.
Mhm.
But I know that I'm coming up on it, and I want to be as prepared for it as I can be.
Exactly. And here's the thing, you are in a stage, there's so many different languages and terminologies used for what pre, peri, menopause, and post is. So addressing that, you're in pre-menopause from the age of about 35,
Right.
which is really challenging because that's at the time that some women are starting thinking about having a family.
Right.
So again, our 35 is very different from our mothers and grandmothers' 35.
Amen. Yep.
So pre-menopause, you could be thinking about your menopause journey, or you could be thinking about starting a family.
Right.
Perimenopause typically happens, the average age is around kind of 45 plus.
Right.
And perimenopause is the transition between normal cycling to menopause.
Right.
And most women, it lasts maybe 5-ish years. Some women, it can last a lot longer. Some women, it's a lot shorter. But it's typically when we start to see those changes in our periods. We might go months without periods. We might have 2 months with periods. The way perimenopause works is, it would be wonderful if it was, but it's not a gradual lowering of our hormones. Our hormones are not gradually tapering off, and it's not predictable. They're doing this all of the time.
Yeah.
So menopause, how we actually diagnose menopause is the one day. You're in menopause for one day.
I learned that on this podcast.
Isn't that mind-blowing?
Amazing. The one day, right? Tell us, for
One
everybody's
day.
listening, but mind
Yep.
blown. Yep.
So menopause itself is diagnosed as one day, and it is the one day after you haven't had a menstrual period for 12 months.
Right.
Anything after that day, you're postmenopause.
Yeah.
So these terminologies are thrown, and it's confusing. Again, this is something that I've had to take a deep dive into. It's really, really confusing. So I like to call it the menopause transition.
Great. I love
And
that.
then it's kind of keeping all of these things. And I think the other frustrating thing, it's getting better now, depends where you look. Menopause is not a disease, and it's not a condition. And we
Right.
need to change it. It's a period in our life. We would never call puberty a disease or a transition, or a disease or a condition, although it feels
Right.
like it sometimes. We shouldn't do the same for menopause. It's just a hormonal transition.
Right. I'm so glad you bring that up. And, I feel like, well, we don't have to focus solely on menopause here, but,
Mm,
certainly, like you're saying, in the 40s, that is a transition that's going to happen. And I feel like I don't want to speak for all women, but so many people that I know, when you find out menopause is one day, it's like, wait, what? So I think that we just aren't educated enough about this thing that happens if you live long enough. It's going to happen, and you are, a biological female,
mm.
right? That is going to happen to every single woman on the planet. It's not like it doesn't happen if you live long
Right.
enough.
But it's going to happen to every single woman on the planet. And it's also because we're living longer these days, we could spend 60% of our lives in menopause or
Yep.
post-menopause. Isn't that mind-blowing?
Oh my gosh. Wait, but like with all the symptoms,
No. So remember, 60% of our lives post-menopause,
post-menopause. Sure, got
not
it.
in
Okay.
perimenopause. That would be a nightmare for anyone. But you're absolutely right, is then I think we go, okay, 40 plus, we're talking about health, we must be talking about perimenopause.
All right.
And actually, that's not the case. Yes, perimenopause is something that we should be aware of, but there are other health conditions that can be mistaken for perimenopausal symptoms, but they can also run alongside. It's not necessarily an and or. If I'm seeing a woman who is, let's say I see a woman who's 48,
Right.
chances are she's in perimenopause. But are all of her symptoms due to perimenopause? No, they could be thyroid imbalances, there could be adrenal imbalances, they could be heavy metals, they could be blood sugar imbalances. So we have to stop thinking if a woman is in perimenopause, all of her symptoms are due to that. It can be an and situation.
So let's talk about you're mentioning some of these tests. And I think
Mhm.
that, one of the things that drew me so much to your program, I'm a Virgo. And when I saw what a deep dive you do into, total blood work, which when you go to your PCP and you get your blood work done, it's generally kind of like the main, you know, let's say like your baseline panel, right? Your
Yeah.
basic blood work. I had to request hormone from my doctor. And it's like, come
Right.
on. I mean, that's something, aren't I of that age? Shouldn't I be aware of this? But what are some of the things that you're recommending, for women in their 40s,
Mm.
in terms of blood work? What are some of the things that you're saying to your clients? Hey, here's what we need to have done.
Yeah, and here's the thing, this is not just women in their 40s, this is everybody. We should all be advocating for health tests.
Yeah.
But as we get into our 40s, there may be things that we're particularly looking at that we wouldn't necessarily be so worried about in our 20s and 30s. So we want to do a full metabolic panel. So for most people, that's fasting blood glucose, that is insulin, that's hemoglobin A1C. I also always want to see a full lipid panel for my clients. So typically, as we get into our 40s and in perimenopause, that balance can change. We have to be thinking about they're often called the diseases of perimenopause. And again, I want to change that language.
Mm.
We have, due to certain hormonal factors that we go through perimenopause and menopause, and then when we're postmenopausal, there are certain conditions that we are more likely to be at risk from. They shouldn't be considered diseases of perimenopause or menopause. So something like cardiovascular disease, once we're in postmenopause, women have exactly the same risk as men. So I
Wow.
really want to look at a lipid panel. What are your cholesterols doing? What are the different types of cholesterols doing in the body? How are your arteries functioning? All of these things, because if we can look at that in your 40s, we're going to be able to optimize it into your 50s and 60s when your risk factor increases. Hormones, exactly 100%. We want to be looking at hormones, and not just hormones in terms of estrogen, testosterone, progesterone, things like DHEA, which is the precursor to our sex hormones, things like sex hormone binding globulin, which tells us not how much hormone we have, but how much hormone is active in the body. Now,
Mm.
as a caveat to this, hormonal testing can be challenging during perimenopause because our hormones are doing all of this. That's always great to get a baseline. That's really, really important. Other things that I like to look at are thyroid health. And again, not just your TSH. Your TSH doesn't tell us anything. That full thyroid panel. There you go. Yeah. Which thyroid hormones are converting into which other thyroid hormones? How much of that thyroid hormone is actually active in the body? Your thyroid function tells me a lot about your adrenal function, how stressed out you are. Essential minerals. I typically see every single client I see with low thyroid function also has low B12, magnesium, low vitamin D.
Mm.
So looking at those panels as well. And then once we have that really, really deep dive into those panels, we can then say, okay, I've got this, 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 and this, but then maybe we need to look further into that. So yes, I really like to look at a lot more testing than your PCP does. And then the other thing is the lens or the range that your PCP is looking at. So your PCP is basically going to be looking at a lens of, are you alive? Do you have any disease markers? Are you Homer Simpson?
Right.
That's what they're looking at. We're not looking at that. I want to know, what are your ranges for a 40-something-year-old woman? Because a lot of the ranges are done with healthy men.
Right.
So what are your ranges? What do all of your panels mean in conjunction? For example, low thyroid function. Do you have low essential nutrients? But also, what is thriving for Amber? Because that's different for you than it is for me, than for someone listening.
Right. Oh my gosh. So, I feel like there needs to be a shift in, like you said, healthcare in general, because I feel like, I found out the other day, I went for my skin checkup, but with my dermatologist, and I got a bill and I said, isn't this covered? And they said, it's not covered with the dermatologist. It's only covered with the PCP, but you don't want to go, no offense, to your PCP
Right.
for
For your
a
skin
skin
check.
checkup. And I was blown, and we have good insurance. So
Mhm.
I was really blown away by that. And I feel like that's a whole other
That's a
conversation
whole,
about
yeah.
this. But so then going into this, like, knowing all of this stuff about this, these aren't tests that you can just ask your doctor for, or are they? It's tough, right?
It's honestly, the whole health insurance in the US is mind-boggling, and there is no black and white or yes and no answer. I find exactly the same. We don't have great insurance. I have to have a minor procedure, and I'm finding that I have the wrong type of insurance, so I'm paying out of pocket to see the surgeon that I want to see,
Right.
and but using my insurance to get the pre-testing. And honestly, even as someone who knows a little bit about the system, it's absolutely mind-boggling. So you could have every single insurance policy is different, whether you're PPO or HMO. And then even in terms of which type of policy you have with each
Yeah, oh, yeah.
provider is different. How your medical practitioner bills
Feels
for
it.
those tests is different. So someone needs to write a book about this. It's not me.
I mean, it's the
But
same. Well, I
it
called
is.
because when I was at my dermatologist, I also got a little Botox. But I pay for the Botox. And then I said,
Okay.
hey, did you guys maybe bill this as just like an office visit and not as a preventative care? Because really, I already paid for the office visit and paying for the
Mhm.
Botox out of pocket, but I was getting my skin checkup. That was the
Right.
main point. But then she told me, she was like, believe it or not, with dermatologists, a lot of plans, it's not covered.
I think, at the moment we have to ask and we have to advocate. Those are the
Yeah.
two things. I always say to my clients when they go and get their test, because I can't requisition lab work myself. So when I work with Dr. Russak, she does that requisition. When you get your lab test requisitioned, check with your doctor's office and or your insurance company as to what is covered and what isn't.
Right.
Because I have some clients with this cavalier attitude and they're like, I've got great insurance, I'm sure it's all covered. And they come back with bills for over $1,000.
Yeah.
So always check what's covered. Always ask your doctor as well. So I'm really learning to be you have to be your own biggest advocate.
Hmm.
So for example, I'm dealing with a minor thing now, it's going to be fine. But my first specialist was, if everything is a nail, then all I have is a hammer. This is the one solution for it. There's no other way. My thoughts were, this is what I do for a living. Let me do some research. So I've now found actually a different specialist who I want to go to has a different way of dealing with it.
Hmm.
But I don't think most people have the time or the research skills. And I only do this because research is a big part of my job to be able to look into that.
I mean,
And also,
also the
would you?
Yeah, and also the access, right? You and I both live in major cities,
Right.
with tons of different medical practices. But I mean, for people who are listening, and we've got worldwide listeners,
Mm,
I think sometimes access to good healthcare can be really challenging.
hugely. And even I live in Boston, super close to New York. I'm actually going to LA for this because
Wow. Okay. You
that's
found,
where I found
yeah,
the best person. Now, I'm super lucky to be able to A, know how to find that out, and B, to be able to have that within my budget. But
right.
I think the other thing is I'm such a, the medical profession, I'm such a huge fan. I won't have a word said about doctors, but a lot of us are too scared or wouldn't even think to question our doctor.
Right.
Always ask that question. Is there things I get my clients to ask if they're being offered a medication? Is this the right brand for me? And is this the lowest effective dose for me?
Oh, that's a good point. The lowest
Right?
effective dose. Yeah.
Lowest effective dose, because think about a dose for, let's say, our husbands who are twice as tall as us. They're going to need more of a medication than us who are half the size.
Right.
So brand is important. Those things can change a lot. Lowest viable dose. What can I do to support this in terms of lifestyle management and diet management? Is this medication going to cause me any more side effects? Am I going to have to start taking another medication?
Right.
Is this the best avenue for me? So my specialist only offered one type of surgery. I was like, I don't think this is the right thing. I'm going to try and find another way. Lo and behold, I found another way. So don't be scared to question your medical providers. And if they get funny about it, you need to find a new medical provider.
I love that you said that. I tore my meniscus, and meniscus it's a knee problem. It won't ever heal itself. And there
Mm,
was a point when it tore where I couldn't walk. I mean, I basically couldn't walk up and down stairs. So
mm,
I went to a really good orthopedist, and they said, you need surgery. And I said, do I? I went to physical therapy, and after 2 months of physical therapy, they're like, we can't get you much better. However, I will tell you this, after 2 months or 3 months of physical therapy,
Mhm.
I'm fine. I don't know that it won't ever be fine, but
Mm.
I opted. I was like, let me go through the harder route,
Yes.
because once you're in surgery, I was like, who knows? You pray to God that everything's going to go right, but who
Mhm.
knows if they're going to screw something up worse. Now, I might need surgery one day. There might come a point where it
Right.
acts up and it's painful, but I like that you said that. I did a little research on my own, and I said, is this my only option? Is surgery my only
Right.
option, or can I do other things? So yeah, being your own health advocate. I do want to throw this in there though, because you
Mm.
are a professional. You work with people professionally. What is that balance that you think of, like not going down the internet rabbit hole and finding out and
Yeah.
deciding from your own that all of a sudden you have a brain tumor when like really you're just,
Oh,
overtired?
we have we've all done it. We've all done Dr. Google. And when I first got my when I first got my diagnosis with this, and again, it's nothing major, it will be fine in the long run. I didn't let myself. So basically, I got the diagnosis, and it could be this or this. At that stage, I did not let myself Google anything.
Okay.
I
Good
was
for
like,
you.
point blank, I'm not Googling anything. Let's find out actually what we're dealing with. Then I found out what we're dealing with, and I took a couple of days. I
Mm,
didn't jump in. That's when I started to look. I didn't let myself look at any gory pictures whatsoever. I started to look at who are the best surgeons for this, and I looked at the patient testimonials.
yeah.
Then I did 2 video consultations that cost $250 each,
Yikes.
with the surgeons. It's surgery on my face, so this is a big deal.
Wow.
And one of them didn't like at all. One of them I was like, I'm in good hands.
Yeah.
So I think you just have to honestly find out what you're dealing with first.
Yeah.
Give yourself some time. Do it when you're like your blood sugar's balanced, you haven't had too much coffee, you're not emotional, all of those things. And then really find out what you're looking for. So I was looking for someone with the same condition as me that had, I was looking for really great patient testimonials before and
Mm,
after. And I was looking for someone who does this surgery day in, day out.
yes. Yes.
That's
Yes.
what I was looking for,
Yes.
because the specialists doing the surgery do it a handful of times a year. I wanted someone that does it day in, day out,
Day
and
out.
that thought I was an easy case, which thank goodness I am. That's what I was looking for. But it should be the same with anything. Let's say, surgery is one extreme, but let's say it's a thyroid issue, and you're trying to find an endocrinologist that works with thyroid issues. You want to find an endocrinologist that has a patient demographic like your own. For example, we are looking at working with a cardiologist at Dr. Russak's office. Now, we don't need a cardiologist that specializes in men in their 70s.
Right.
We want a cardiologist that works with women in their 30s, 40s, 50s, and 60s that aren't necessarily sick, but want to optimize their cardiovascular health.
Right.
So it's not just a specialism. Look at that provider's demographic as well to find the right fit for you.
I love that. And go on sites like Yelp. Go on, don't just go on the reviews on the doctor's site,
Because
because
all they're going to have is good ones.
they're only going to have the good ones. So I
Right.
love
Yeah.
that's great advice. And by the way, I hope, we can catch up after this, but I hope everything
Yeah.
is okay. And
I will all be fine.
I'm
By the
here rooting
grace
for you
of
and if I can help.
whoever, it's
Yeah,
all good.
for sure.
Yeah.
And I also know if it has anything to do with the face, Dr. Russak will have you covered.
Exactly. 100%.
um, so in terms of like beyond blood, our optimizing our bodies so that we can
Mm.
better handle some of the transitions that are coming once we get into our 30s, 40s, 50s and older. What are some of the other things that you're thinking that we really as women need to address, or look at with a different lens than maybe we did in our 20s?
Yeah. And I think if I could figure out the key for this one, I would be a multimillionaire. Dr. Rusak and I have this conversation all of the time, is figuring out that stress management piece of the puzzle.
Oh, yeah.
Right?
Yeah.
I can get it's so easy for me to get my clients to eat right, to exercise, to take supplements, to do all of those things. the stress management piece of the puzzle is so huge. And personally, this thing that I'm dealing with, it has no risk factors whatsoever, apart from being a woman in their 30s and 40s. I personally think this is my wake-up call of I need to deal with my stress and anxiety.
Oh, wow.
Medically, they're not related whatsoever. But you know, when you're just like, I think there has to be something here.
Yeah.
So I often, and I'm seeing this more, and we've seen this at Dr. Russak's as well, is that women in their late 40s, early 50s are coming to us at crisis point.
Yeah.
Because they are at their stage. Now, here's the wonderful thing about being in your 40s and 50s is that you're in a really great place in your career.
Right.
You put the hard work in and you are at the top of your game.
Right.
But with that comes so many stresses and responsibilities. Whether you have kids, whatever you have family, you have responsibilities, you have stresses, and you're at the top of your game in your career. And so many of these women come to me and I can hear, you know, even if I'm not seeing them, I hear it in their voices. You can hear that their blood pressure is up, their stress levels are up, they're literally at breaking point.
Yeah.
And I think that is, the stress is such a huge impact on so many parts of our health. And I think we all need to stop underestimating that. And again, that's a whole other conversation.
Yeah, but it's really important to bring up. I mean, we know, look at, you know, we say this, look at a president when the day they enter office, and 4 years later, they look like they've aged, I mean, 20 years, really. So we know that stress will not only, and because we're a beauty podcast, right? We know that it's really going to take a toll on our exterior, but also what we know, our interior as well.
We can't separate that interior and that exterior. We just can't. And stress, the reason why, I think once people understand why stress is so important, why managing our stress is so important for our health, it helps us think a little bit differently. So stress is what we call catabolic to the body. Stress will break things down. Stress breaks down your cells and your tissues. So this can be everything from your bone density to your muscle mass, to your gut health, immune function, reproductive function, cognitive function. But yes, that the example of the presidents is exactly well, because you can see it. It's skin and it's hair. Stress breaks our bodies down. And that's why we get so many, that's why so many of our chronic diseases, and not even just our chronic diseases, but our diseases or conditions that make us feel not 100% are impacted hugely by stress.
Yeah, I mean, it's really bad. You know, it's funny, you're talking about stress, and I know this is a much longer conversation, but NAD plus, right? Is that something I've heard that, have you heard anything about that being able to affect your gray hair?
So NAD plus is the new darling of the supplement world. And we, every so often we hear these things come up, you know, a while ago, CoQ10 made its way back. There's always something. NAD plus has been purported to, in non-scientific terms, have anti-aging benefits, which is where the gray hair thing can come in. Now, we do have some evidence on this. We don't have enough. It hasn't been studied enough. But do I personally take NAD plus as part of my, whatever we're calling it these days, healthy aging regime? Yes, I do.
Oh, yeah. Okay.
Is
there one you take?
There's a company called Elysium, and they have a supplement called Signal. That's the one that I take. You know, and what we're thinking about with supplements like that is reversing epigenetic changes on a cellular level.
Right.
So what has the external environment, and we say external environment, but that is kind of wrong because it's stress as well. So that's internal. How has that made changes in our cell, and can we reverse those? So yes, do I think NAD plus can be a good supplement? Yes, but I will always say there's no quick fix and there's no magic pill.
Oh, you know what I'm also thinking? The other one that I read about that had a gray hair effect was glutathione. And maybe I'm getting them confused. So I just want to point out, though, you turned me on to the Live On lipospheric supplements. So I've been taking BC glutathione. Now, I went to my hair person the other day, and she, you know, I just have them cut the gray hairs because I don't have a ton. But she cut one out and she's like, this is the weirdest thing. It's brown. It was gray at the end and then brown near the root. She's like, I've never seen this. And I was like, I have been taking glutathione every day. Maybe that's it.
So glutathione, it's funny. I just wrote an article for New Beauty about glutathione. Again, it's the new the new darling of the
Right.
supplement industry,
Yeah.
but we've been recommending it for years. Glutathione is a very, very potent antioxidant. So we consider it as the master antioxidant. Now, antioxidants help to minimize oxidative stress, which can have epigenetic changes in the cell. Is it reversing your gray hairs? Who knows? If we think it is, let's keep doing it.
I mean, I'm sold. While we're on this, and I want to talk about so that company Elysium, I know that when I met with you, they actually offer a test which you support, which is
Yes.
can you tell us about that?
Yeah. So do I have one? I have one here, but it's in the pile.
I'm dying to try it.
Oh my goodness. So I've had one for months and I haven't been brave enough to do it.
Oh my gosh, it'd be like the first thing I ever want to do. Tell us all about it. I'm like so
what
psyched
it
about
does,
this.
So here's the thing. I can look at lab work and lab testing and all of that stuff and I geek out on that. But I think for most people, it can be really overwhelming. It's almost like, okay, you've got all of these numbers, but what does this actually mean? The test that Elysium does is a test that is, and there's a number of companies that do it, but this is the one that we use, is your chronological age versus your biological age. So how old are you as, on your birth certificate versus how old is your body? And that's what that test does. So I've had one for ages. I'm like, oh my God, I'm so nervous to do this because what if mine comes out, that I'm the same age or older? But so I will do it. I promise I will do it. And reach out to Elysium as well, because I think it's so interesting. And we've had our clients and patients do it too.
I mean, I can't wait to do that as part of your program because I just find it so fascinating. And then, it's something I went on their site, by the way, it's not an inexpensive test. I think it's about $500, but I mean, hello, it's like the ultimate either validation of everything you're doing or I hate to say it, reality check. Right. Because if you're spending, and I think a lot of people on, who listen to this podcast, I'm sure we have people of all different demographics, but when you think about some of these procedures that we do or even creams, I mean, even if you're buying a $30 cream at the drugstore, you're talking about over $300 a year in doing that. And wouldn't you want to know that money is actually making a difference or some sort of a difference, or the supplements that we're taking?
Right, exactly. And I think that's really, for me, I only recommend testing if it's going to create an intervention. So what I mean by that is my clients will ask me for all of the tests under the sun. And I will say, if you take this test, is this going to change your behavior? So I think for some of our clients, doing their lab work and doing a test like this, it's a wake-up call. But we had one of our patients at Russak Dermatology who'd done our, let's say, the first version of our wellness. And she'd been with us for a couple of years, and she was 5 years younger than her biological age. Her body was 5 years younger than her chronological age, what it says on her birth certificate, which I love because she's also 48 and in the middle of perimenopause.
Wow.
So even if she's in the middle of perimenopause, so our goal with her is 10 years.
Oh, and that's why I'm interested to see. I would say, we keep talking about this program that Jennifer is doing with Dr. Russak. We did a podcast on it. You should go and listen to that because it's a very interesting total body approach to beauty, which I think is we're going to be hearing more and more about. I think that we're talking about more about holistic wellness is really coming more into the mainstream of it's not just your PCP or your acupuncturist or, your dermatologist, if you can get, or your nutrition, you really need to look at a total picture in order to maximize benefits in any one specific area.
And this is the thing. And as you think, we're spending so much money on procedures and creams. I mean, I've just had to quit my eyelash extension habit because I added it up and I was like, whoa.
Lashify.
Lashify.
I'm wearing them right now. Lashify. I'll and I should do a podcast on that. It's my favorite, and I can tell you all about them. But it's when you need to bump them on, they go on really quick, and it's very affordable, and it won't destroy your lashes.
There we go. Yeah. But we spend so much of this money. What is working and what isn't? And then the other thing is, the reason why I started working with Dr. Russak all of these years ago is that her patients were not getting the results that they wanted from the procedures because their bodies weren't optimized. So if we're trying to get you to produce more collagen, if we're trying to get you to reduce your inflammation, if we're trying to stimulate, I mean, Dr. Russak talks a lot better than this, but stimulate your stem cells, your natural recovery, we need to give your body the raw materials for that. And that's where that intersection comes in. And I just find fascinating.
I love that you just said that, right? Because a lot of, when we talk about we're trying to get a repair response. If your body doesn't have the correct nutrients, if your body doesn't have the building blocks to create that new collagen, you're not going to get the maximum results. It's not that you're going to not have any, but nutrition plays such a huge key in that.
Or even if, we want to go deeper and deeper and deeper, even if a lot of us, you hear this word health on a cellular level. Well, that's kind of a buzzword because we're made of cells. All health is on a cellular level. But even just as simple as something as what we call the phospholipid bilayer, or your cell wall. Now, your cell wall is really important for getting things in and getting things out, but also really essential for cell signaling. So if you are super inflamed, your cell wall is not going to be made of the right ingredients. If your cell wall is not made of the right ingredients, we're not going to, no matter how hard we try, if we're trying to activate the signal to repair, to grow, to produce collagen, we're trying to activate that cell and it's not getting the signal, it's not going to happen. So it's building blocks, it's signaling, it's what these cells are made of. And I could talk about this for ages, as you can hear, but if we can optimize that, then talking about money, you're going to get so much more value out of your treatments as well.
Amen to that. Before I let you go, is there anything else, again, that you think that maybe we should any other takeaways as women, as we're getting into our 40s, 50s and beyond, that we really need to be thinking about in terms of maximizing our beauty, maximizing our health, maximizing the way of looking and feeling good?
Stress, sleep, you know what I'm going to say? Lift some weights and eat some protein. Those are the simple things. And then I will also say, be your own best advocate for your health and don't just get brushed off with it's your age, it's your hormones. Find out what's really, really going on. And if you can't talk to a provider, find another one.
I love that. Now, I know you have a lot of programs coming up right now. Can you tell us a little bit about those if people want to know more?
Yeah, probably with everything that we're talking about, the program that we do at Dr. Russak's is probably the one. We tie everything together. So you get the wonderful Dr. Russak, you get all of the testing, you get all of my recommendations. We find out your chronological age versus your biological age, all of the supplement recommendations, health coaching one-to-one with me. So that's with Russak Dermatology. That's the best place to find out. I'm sure you'll put that in the show notes. So they're Russak Derm on Instagram, or you can come and find me, Jennifer Hanway, on Instagram.
Amazing. And you do a lot of, also, if you're just looking for the nutritional part of it and you're not in New York, you do amazing virtual programs and
we have a weight loss program called Lean and Clean, and then I'm just launching something called Thriving Through Menopause as well, because it's much needed. So feel free to reach out to me as well.
Amazing. I want to thank you so much for being on. I will be doing that program. I've said it before. I'm ready to do it now. And so I will let you know how that goes. We keep it honest here. If you have any questions you want me to pass on to Jennifer, I'm always happy to do that. You can email me at hello@ArtBeautyPodcast. You can find us on Instagram, Facebook, and YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.